So Megan, we've had a great opportunity to talk about some things today. And I think one of the things that we both think is important is perhaps emergency contraception.
Right.
And since your last intercourse was less than 5 days, we did have a couple of options.
Okay.
From what I heard you say, though, it sounds to me like the copper T IUD would be not only beneficial as an emergency contraception, but would also provide you with what you're looking for, and that's long-term pregnancy prevention. Is that kind of where you're leaning towards?
Yeah, that would
Okay.
that would be good.
Okay. And that is something that we have here today, and that can stay in actually up to 12 years, so that's a great option.
Great.
When we talk about IUD insertion, there's a couple things that I just want to share with you. And so some of the risks of IUD insertion are heavy bleeding.
Mhm.
And so what we'll have you do is take ibuprofen, which is an over-the-counter pain medicine.
Right.
It will help to decrease the amount of bleeding, but also helps with any kind of cramping and pain.
Okay.
If the bleeding were to last longer than 7 days or become unexpectedly heavier than a normal heavy period for you, then I'd want you to call our office and come back in and be seen.
Okay.
Another risk might be infection. And so we used to think that we had to have test results back for sexually transmitted infections prior to putting in an IUD.
Mhm.
But really now what the literature says is that as long as I don't see any signs of infection, it's okay to put in the IUD, and we're going to screen you anyway. And so we can
Okay.
treat later if we need to.
Great.
If I do see signs of infection today, though, then I won't be able to put in the IUD. We'll need to treat you first and then have you come back in. And once the infection's clear, we can put in the IUD.
Okay.
The other thing, and I've actually not had it happen with any of my patients, but it's something that's called a perforation. And that can mean that the IUD actually goes through the uterine lining. It can happen during the insertion, or it can migrate out after you've had the IUD in.
Right.
If it's hard for me to put the IUD in today, I'll stop, and we may do some further testing before we try to reinsert an IUD. But if we get it in today and you have a lot of pain or develop any other symptoms, fever, anything like that, then I'd want you to come back in and see me. Does that make sense?
Yeah.
Okay.
Yeah.
What other questions do you have for me today before we kind of get you ready and move forward?
I guess just, have you had any patients that had like other severe complications with it?
I haven't personally had any patients who've had any severe complications, and we put these in. We put about 6 IUDs in our practice in a day, and so it's something that's very safe, it's very effective, and it's frequently used here. So I think it'd be a great option for you.
Okay, sounds good.
All right, well, I'll get the nurse and we'll get started.
All right.
Thank you.
Thank you.